Hello and welcome back to Dr. Robert's Diary of Rural Today we are going to talk about how it is never too late to switch to a job in public health. Have you ever thought how important good public health is in developing countries? It is very important because many people in these countries do not have access to basic health care, clean water, or good sanitation. Public health professionals work to improve the overall health and well-being of people and communities by focusing on preventive measures and community-based approaches. One of the most important ways that public health reduces healthcare disparities in developing countries is by focusing on the needs and problems of vulnerable groups. Public health professionals make sure that groups like women, children, the disabled, and the elderly have access to healthcare services they need and are safe from health risks that can be prevented. But you may be wondering,
Dr. Roberts, I've been building my career in another field for years. Is it too late for me to change career and work in public health?
The answer is a loud and clear no. You can always make a change and follow your passion. Whether you're a nurse, a social worker, an engineer, an IT specialist, or even a business professional, there are many ways to use your skills and experience in the field of public health for development. And with global pandemic and outbreaks of infectious diseases, the world has never needed public health professionals the most. So if you feel called to make a difference in the world and improve the health and well-being of people and communities in developing countries, don't let your current career hold you back. Think about learning more about public health and epidemiology. Vaccination programs are an important way that public health has helped to improve health in the developing world. We have seen a big drop in diseases that can be prevented by vaccines, like polio, measles, and other contagious diseases. This has saved lives and made people live longer and healthier lives. Also, people who work in public health are very important when it comes to distributing health resources to meet the needs of the population. They try to figure out where health services are needed the most and make sure that the resources get to the people who need them the most. This includes making sure that communities have access to basic healthcare services and clean water and sanitation facilities. Epidemiology is an important part of public health as well. Epidemiologists try to figure out how diseases spread in different groups of people. They use this information to come up with effective ways to improve health. Epidemiologists make important contribution to the development of effective public health programs by studying the spread, causes, and control of disease population. We should also talk about health policy, which is an important part of public health. Policy is how government organizations decide to spend money to improve the health of the public. This means working with people from different fields like healthcare, education, and government to make policies that meet the health needs of communities. The passing of laws that encourage healthy behaviors like bans on smoking, food labeling, and limits on selling unhealthy products to children is an example of a healthy policy. Another example is the creation of health insurance programs, which aim to make it possible for people to get medical care at a price they can afford. Public health professionals are very important to the health policy because they make recommendations based on evidence and help shape policies that promote health equity. They work to find the most important health problems that affect certain groups and come up with their solutions that meet their needs. If you want to work in public health policy as a career, there are many ways to get involved. You can work for government agencies or non-governmental organizations to help create and implement health policies at local, national, and international level. As you can see, public health is a key part of making people in the developing world healthy. As a public health worker, you will have the chance to really help people and communities in need. You can help make big changes happen, like making sure there are no more preventable deaths of mothers, no more unmet needs of family planning, and no more violence based on gender. So what can we do as a society to help support these efforts? We can help organizations that work to improve the health of mothers and children and teach people about family planning and give them tools and speak out against harmful practices like violence against women and children and child marriage. In conclusion, public health is an important field that gives people who want to make a difference in the world a lot of chances to do so. There are many ways to use your skills and experience, whether you are just starting out or looking for a change. By working together, you can make a world where everyone has access to basic health care, clean water, and good sanitation, and where diseases that can be prevented are a thing of the past. Thank you for watching, and remember, you can make a difference.